Hi, my name is Michelle Thomas. I'm going to be talking about childhood overweight and obesity. Childhood overweight and obesity has become an epidemic in the last 10 years. It's more than doubled the percentage of kids who are considered overweight. Parents need to step up and take the responsibility for their children's diets and health. Children ages 2 to 6 years old who are overweight do not need to be put on a diet. They just need to have their eating habits changed so that they can maintain their weight and grow into a healthy weight. So as they grow, they will slim down. Some of the risk factors for childhood overweight include a risk of a variety of health conditions, diabetes, heart problems, asthma. Overweight can contribute to many health problems over the years. Not to mention psychological ramifications of, being socially outcast by their peers. It can cause depression. Just those things alone should make parents want to step up and take responsibility. Help their children learn healthy eating habits, learn to exercise, take it seriously. It doesn't have to be a grueling process for parents and children. Children don't need to be made to feel that they are fat, so they have to go on a diet. In fact, that's totally inappropriate. Parents should just incorporate healthy eating into everyday life, so that way their children develop good habits. They don't have to make their children feel like it's their fault, because it isn't. Many children who are overweight, however, do not become obese adults. A lot of times it's just a lack of healthy eating habits, a lack of exercise that contribute to this. After age 4, children with a body mass index, or BMI, that are increasing into the 85th and higher percentile could be at risk for continued overweight into adulthood. But parent education is absolutely key. Parents need to become educated on what they can do to help their children, healthier eating habits. The food pyramid, food guide, they need to know how much of everything their child should be eating. Avoid using food as a bribe or a reward. Food is just something to, maintain your energy, give you energy. So, giving them dessert as a reward, not a good idea. Between the ages of 2 and 5, children will begin to show signs of being overweight. Before a child enters kindergarten is the best time to instill healthy eating habits for your children. That will help them make better decisions at school. Snacks that they're going to be eating, lunch choices if they have them. Children who suffer from being overweight tend to have more problems, obviously physically and medically, but also socially and academically. They already, may feel like a failure because they're different than their peers, or their peers might start noticing, making fun. So then they just become apathetic to everything in their life. So parents who have difficulty setting limits or healthy eating habits themselves, they need to seek positive reassurance. They need to seek out education on how to teach their children to be healthy. Talking with their doctor, healthcare provider, local health department, those are the best places to get information about proper childhood nutrition and growth. Your doctor will use a growth chart, such as this one. Depending on your child's age and height, it will let you know how much they should weigh. So be sure to ask your doctor or your healthcare provider, or go to your local health department. You can access that for free. That's free information. That's really the best place to start. Does anyone have any questions? Yes. Okay. The question was talking about parents needing to educate themselves. What are some ways to do that? Well, as stated, go to your local health department. They have free printed information. The health officials there can definitely talk with you, maybe talk with you, give you information about classes that are available. Another good place to look up information is the internet. However, beware that there is a lot of information on the internet that is false or misleading. So always talk with a healthcare provider about your child's health and weight. Make sure that their weight is not simply baby fat that they have yet to grow out of. Do not put your child on a diet, on a specific, strict diet. You can talk to your child about being healthier. You know, everyone in a family could always eat healthier. So do not tell them that they need to lose weight. Tell them that they need to get healthier, which includes eating better and exercising. So I would say that would be the best way for their self-esteem, for their self-image, is to just let them know that they need to get healthy. Does anyone else have a question? No. Okay. That's it.